Good afternoon. I'm Brent Roussin, Manitoba's Chief Provincial Public Health Officer. Today we're announcing 16 additional deaths due to COVID-19. A male in his 70s from the Winnipeg region, a female in her 70s from the Winnipeg region, a female in her 70s from the Winnipeg region, a male in his 70s from Southern Health Santé Sud, a male in his 70s from Southern Health Santé Sud, a male in his 80s from the Southern Health Santé Sud, a female in her 80s from the Winnipeg region, a female in her 80s from the Winnipeg region, a female in her 80s from the Winnipeg region linked to the outbreak at Fred Douglas Lodge, a male in his 80s from the Winnipeg region linked to the outbreak at a female in her 90s from Southern Health Santé Sud linked to the outbreak at Buhler Active Living Center in announcing a list such as this impacts on all of us. It's a difficult list to, and this is a tragedy for all Manitobans. And so we know that these are much more than numbers. These are people who are missed right now. And we know that we can't continue to read lists such as this daily. As of 9:30 a.m., 283 new cases of the virus have been identified, taking our total to 17,107. Current 5-day COVID-19 test positivity rate is 13.1% provincially, 13.8% in Winnipeg. And so we see our numbers, while not climbing rapidly, are still not where we need them to be. These numbers are still too high for us to sustain. Our hospitalizations and ICU numbers are too high. And we keep sending that message to stay home, to reduce the amount of contacts you have, to really bring the number of cases down rapidly. So only go out for essentials, send the minimum amount of people out of your house for those essentials, preferably one if possible. And all gatherings outside your household pose a risk. So we're asking Manitobans to avoid gatherings right now. We're asking employers to try to limit crowding within their workplaces, have employees work from home as much as possible, have other safeguards in the workplace if not able to work from home. We don't want people to socialize with individuals outside of the household. Right now, socialization should occur only within members of your household. And this is all our responsibility. All Manitobans have that responsibility to step up right now to decrease their amount of contacts. We know probably the majority are chipping in and doing their part, but we need everyone to come on board. And we've said it, and it's certainly true, and continues to be true, and will always be true, is that these restrictions are tough. Pandemics are tough. And we're asking a lot of people to avoid things that they feel are very important to them, things that are very difficult to give up even in the short term. And so we know that's very difficult for everyone, but the situation we're in is critical. Our hospitals are reaching capacity, our healthcare workers are overwhelmed, so we're asking Manitobans to step up in the short term to find alternate ways to do those things that they enjoy, those things that they love. for the short term. It's not always going to be like this, but we do need to decrease the number of contacts we have. We know that our healthcare capacity is being pushed, our daily numbers are too high, but we know exactly what we can do. We can stay home, decrease these amount of contacts, we'll see these numbers coming down, and then once again we can start getting back to some of the things that we love. It's not always going to be like this, but it is like this for right now. So thanks again to all Manitobans who are putting in the effort, and I can open up for some questions.
Thank you, Doctor. A reminder to our reporters on the line, you will have one preliminary and one follow-up question. Up first this afternoon from the Brandon Sun, Michelle.
Good afternoon, Dr. Roussin. Are you aware of the situation with the Brandon Police Service headquarters? There have been 8 cases so far among City of Brandon employees and 6 from the Brandon Police Service. We're wondering whether the province is monitoring the situation and if they've told police to make any changes to processes and procedures.
I don't have any specific information to share on that. Like any cases, the case and contact investigations are done at the regional level. But I don't have any specifics to share on that issue. Okay,
thank you. Another question I have is when outbreaks proved quite alarming at Maples and the care home in Steinbach, both received quite a bit of attention. Yesterday I asked about Fairview and I didn't really get anything. What's going on at Fairview? Were there pre-existing issues with level of care? What is the situation on the ground from your perspective?
Well, I think a lot of that is operational questions, so that'll need to be directed to the region for that, especially around pre-existing conditions and things. So I don't really have a large update on Fairview, but certainly questions can be directed to the region on that.
From CJOB, Will.
Good afternoon, Dr. Roussin. The NHL has set its sights on January 1st to kick off the season, which means training and practice would need to happen sometime over the next 4 weeks. I'm just wondering if there's been any back and forth between yourself and the Jets to discuss protocols for training camp?
Some discussions, no final decisions made. So we'll have more to offer on that at some point.
Okay, thank you for that. I also want to ask you about healthcare workers who have tested positive for COVID and then later cleared to return to work. So how exactly are they cleared to the return, and is that process different than just like the rest of the population?
Yeah, so it's a bit more, people working in a high-risk situation. There's a bit of a difference in the time frame. So for the majority of people in the population, we look to 10 days post-symptom onset. And at that period, if you are without fever and your symptoms have improved, then we consider you recovered and no longer required to self-isolate. For a healthcare worker, return to work, it's going to be 10 days post-symptom onset plus 72 hours of being without symptoms. So a little bit more stringent on those requirements just because of returning to a vulnerable setting, but we do not require a negative test because, as you recall, our PCR test is likely to be positive for weeks and sometimes months after somebody has recovered.
From the Winnipeg Sun, Scott.
For asymptomatic testing at schools. They're doing it in Ontario, and there's been claims made by you guys in public health that transmission isn't happening there, but would that asymptomatic testing there actually go further to actually support that, I guess is what I'm asking.
So, so right now we're looking at all sorts of options, right? Of course, this requires a lot of testing capacity for this, the asymptomatic testing. If it's, as far as surveillance, we did a lot of asymptomatic testing earlier on with regards to surveillance testing at urgent cares and emergency rooms, and that included Children's Hospital. We didn't find many positive cases through that asymptomatic testing. But just like anything, we consider having the kids in school quite important. So we'll continue to look at ways moving forward that we can ensure that can continue, and whatever steps we can put in place to even make it even safer.
Thanks for that. And my follow-up is on the hospitals. There's 3 more outbreaks at various hospitals in the city today. We're told that hospitals have precautions in place, PPE requirements, and all of that. Everything, the gamut of trying to keep it out of hospitals. But why are cases and outbreaks still happening at these locations with all these precautions that you guys say are in place? Why is it still happening there?
Well, it's going to depend on the situation. So we do look back and investigate because obviously we want to learn from each of these. And so I can't really speak to any specific, and certainly can't speak to the current ones that you mentioned, the most recent ones. But we have seen things like breaches in PPE, which are very easy. It's very difficult to maintain perfect PPE use for for an entire shift and constantly. So we have seen some minor PPE breaches that have led to outbreaks. We've seen examples of patients that were not identified to be at risk for COVID for various reasons that later led to exposure. So there's lots of the reasons to it. I think that recall that we have we've had a number of admissions, right? So I mean we've had over 1,000 total hospitalizations. And so for the most part, there is a lot of great work being done to prevent the transmission within these facilities. But at times we'll see some transmission. We just want to continue to learn from it each time.
From CBC Radio Canada, Emily.
Good afternoon. We're like 10 days away from the 11th of December, sorry. And I was just wondering, when you look at these numbers that you're announcing every day, is there any restriction that you think must go on and some that you're maybe planning to lift at the moment? Could you say anything about this?
I can't say anything specific. Of course, we continue to look at the restrictions constantly, and we know that these are set to expire on the 11th. So once we have a decision on where we're moving with those restrictions, then we'll be sure to let everyone know.
Thank you. So we had an update about the enforcement that and the tickets and warning that were issued last week. We can see like 5,000 tickets, 48 tickets for individuals. Are those numbers a concern for you, and what would you say about this?
I think that the public health approach to any issues is always multifaceted. So we have our messaging, we have testing, contact, case identification, isolation, contact identification, isolation, and then we have public health restrictions, and then we also have enforcement. So it's just one of the tools that we use to try to manage things. And I think that we articulated early on that we're at a stage right now in the pandemic, well within the second wave, where we needed to make change happen. And we know from our modeling, we know from the evidence that restrictions such as what we have are effective, but they also require adherence. And so on top of our messaging, we knew we were going to require some level of enforcement. And so this is what we have here. So we just need to continue to get that message out that this is a vital time for Manitobans, and we need adherence to these restrictions because we know they work. They've been demonstrated time and time again to be effective.
From CBC Manitoba, Bart.
Hi, Doctor. Further to Scott's question, what they're doing in Ontario is they're using rapid testing. Why not move portable testing devices into schools to get a sense of what's going on there right now, especially given the extremely high test positivity rates we're dealing with in the community overall?
Yeah, so we're looking at different aspects. We don't have a plan in place to do that immediately. We know different regions have different approaches, different places where they're using some of their rapid testing. We certainly will, follow the outcomes of a number of those areas. So right now we're testing symptomatic people. We're doing our case and contact investigation. We're not seeing a lot of transmission within schools. But in saying that, we're constantly reviewing things. We're looking at where can we use some of our capacity as we want to increase our rapid testing capacity, and so that could potentially be a place where we utilize that.
Doctor, in your opinion, which age groups, ethnic groups, professions, and other groups should get the COVID-19 vaccine first?
We're working on that list right now, and so when we have a decision on that, we're working here in the province, working at the national level. We'll have that list and a solid explanation to Manitobans on that process. But right now, we'll wait until we have something to announce.
From the Canadian Press, Steve.
Dr. Roussin, just looking at the latest weekly epidemiological report, close contacts remain the overwhelming majority of cases that can be traced or that we know of. Can you tell us where are people catching the virus? If we've had these restrictions in place for a few weeks now, is it, you say it's not at school, is it at work? Is it indoor social gatherings? Is it small gatherings in homes, that sort of thing?
It's again varied. So we do see it in workplaces. We see it in households. We see it in household transmission. We see it in smaller gatherings within households, and so it is varied. But yeah, that's pretty much where we're seeing it right now.
Okay, and the numbers today, the daily case count is quite low compared to other days in recent memory. The number of deaths is higher. What does that tell you about whether we're bending the curve and the impact, the lag between measures, the effect on the daily case count, and the effect on outcomes and hospital data?
Yeah, and so I think that, over the last couple of weeks, we can see that our case numbers haven't been escalating. We've seen some variability, and today is another day, so we would hope that this is starting to show a more clear trend downwards. And so we know the lag period on this. We would see some early indicators, such as decreasing the amount of contacts per case. We'd see that followed by a reduction in the amount of total cases. And then again, that would be, much, ahead of a reduction in hospital admissions and ICU admissions, and then finally lagging into severe outcomes. So, right now we've seen the benefit that our modeling numbers weren't reached, where we thought that by this week or next week we might be seeing 1,000 cases per day. But we know that we're not satisfied with where these numbers are right now. We need to see them come down further.
From CTV Winnipeg, Michelle.
Hello. Will the province be seeking help from the Canadian Armed Forces to help with the COVID outbreak in Shamattawa First Nation?
Well, I think that's not really through the province. We could direct that question to the community or to FNIB. I think that most places right now don't take anything off the table on where supports might be required. But that's largely going to be led through the community and through FNIB.
Thank you. Second question is, should hotel goers be concerned about people staying in hotels that have people isolating due to COVID in them?
Yeah, so this is, there's a lot of safeguards in place. When we have these alternate isolation accommodations, people are largely, they'll be self-isolating within their rooms. There's a lot of housekeeping being done, so that's not really an issue. We have a number of safeguards in place to ensure people who are isolating or are separated from others.
From CHVN, Taylor.
Hi, good afternoon. Dr. Roussin, is the province considering allowing drive-in religious services?
We, again, these restrictions are set to expire on the 11th, and so we're working right now on what the next set may look like. And so we will continue to review all these type of issues, including that.
And in 3-ish weeks, it's Christmas. Are you worried about gathering sizes during this time?
It is a concern. We just, there's nothing about this virus that's surprising us. That this virus is being transmitted exactly as we know it can, and it's being transmitted in settings that we've always warned against. And so we know that the holiday season is quite meaningful to probably most Manitobans, and it's going to be a real challenge because we've been at this for 9 months, and now a holiday season coming up. I think it's going to be very difficult for people to stay focused, but we need Manitobans to stay focused. We can't have a lot of gatherings outside of your household because we just know that that's where transmission takes place. And those gatherings, no matter how much you want them, no matter how important they are, make no mistake, they will put you and others at that gathering at risk. And in keeping with the transmission of virus, that puts all Manitobans at risk. So our holiday celebrations are definitely going to look different. We have to get through this, this second wave.
From the Winnipeg Free Press, Danielle.
Hi, good afternoon, Dr. Roussin. At least 5 COVID cases have been identified in one classroom at General Vanier School in Winnipeg. Why hasn't the province declared this an outbreak if the definition for a school outbreak is 2 cases that are connected in a school facility?
Yeah, I don't have details on that. It's, it depends on the nature of the transmission, who is, if people were self-isolating at the time. So I can't really speak on to why that, why specifically they haven't made that determination there.
Okay, and I wanted to follow up on this community transmission rate. So we've been talking about 50% of cases being linked to community transmission, but it seems that you're including cases that are still pending investigation, that those investigations haven't concluded, and that makes up a quarter of the cases right now. So can you just explain why you're putting those pending investigations in with community transmission and how long those cases are typically in this category?
Yeah, and so that's it's a little bit misleading with that, because when we have those 25% that are still what we would call open, that for the majority of them, that doesn't mean they're still being investigated. Most of them means that they're just not closed yet. The person is still being followed, or the like we said, with our capacity, the closing of files to say someone has recovered, that's been lagging, and that's why we're using this auto dial, which will start catching us up. So so definitely, if somebody who is not yet connected to another case, will consider community-based transmission, because by definition we haven't connected to a case, but it's certainly not in reality a quarter of our cases that are left open that are still being investigated.
From Global News, Shane.
Hi, Dr. Roussin. Thanks for taking my call. I'm wondering, you've mentioned that the daily case count's doing a lot better than what the modeling had predicted. But I'm wondering how it's doing compared to what you would have expected to see heading into the third week of restrictions?
Yeah, so I think that, when we put those restrictions on, certainly the goal was by the 11th, we would have a real clear determination that we're improving our numbers. So I guess we're still not out of that yet. But I would say that we were expecting our numbers to be dramatically improved by the 11th. In a way you could see that if we were supposed to be seeing close to 1,000 cases today, then we have seen a significant benefit. But we were really wanting to see those total numbers come down, really for the most part, is so that we relieve the strain on the healthcare system. And so we're still working on it. We're still, interested to see what this trend is, what things will look like through this week. But we weren't wanting to see still, averaging over 300 cases a day at this point.
And Mr. Pallister kind of hinted today that that he's expecting the restrictions to be extended after the 11th. I guess with the numbers you're seeing, do you have any insight on that?
Well, on the details, when we have something to announce, we will. But I think it's what I can say now is our healthcare system can't sustain daily counts like this. And so we need to ensure we can sustain our healthcare system.
Thank you, Doctor. We have time for just a few more questions this afternoon. Please proceed.
Hi there,
Hi, Doctor.
This is Danielle from
Michelle.
I just wanted to
Letourneau
follow up
from
on the community transmission when it comes to schools. Can you just explain what data the province uses to back up that claim that there isn't transmission between children and teachers in the classroom when we aren't doing any targeted or asymptomatic testing?
Yeah, well, we do thorough case investigations and contact tracing, right? So like you see, we see a lot of cases within within school-aged children, and so we find that case, we document their contacts within the school setting, and we're just not seeing a lot of secondary cases within those contacts. So. And we link a large proportion of those cases within school, and so based on that, we're just not seeing that evidence of school within the facilities, not to significant levels.
Thank you.
Hi, Dr. Roussin. It's Michelle from the Brent Sun. I have a little grouping of questions that are related. Why has the information been removed from the government's website regarding Manitoba businesses that have been fined? But also, we keep hearing that community transmission is uncontrollable, but the government website is only listing exposures in schools and occasional business or transit service. Would there not be more locations released on this list of exposures with community transmission as high as it is?
Oh, okay. Yeah. So I'm hearing that the public health, the fines for business has been moved. So we can get you that information on where it is. We still will list places where there's been thought to be significant exposures in the community. Where we feel that all the contacts could be identified and reached, then we don't list that because there's no benefit. When you talk about community-based transmissions, the kind of the issue there is that by definition we don't know where somebody obtained it or acquired the virus, so we don't have a place to list. So that's the problem with when we see the community-based transmission. It's just actually by definition we don't know, we don't have a place to list. So that's why you're not seeing increasing places listed.
Great, thanks.
Doctor, it's Bartley again. Lots of government offices still have workers working in the office, if you can't get your government colleagues to listen to your advice, how the heck is private industry supposed to follow it?
Well, I mean, I don't think that's a question for for me. I think my message is clear, and that is that when possible, when you can achieve what you need to achieve at home, then employers should strongly consider doing that. And so that's the message. So I'm not sure on who follows it. I'm not sure on how practical it is, or if they can achieve what they're doing at home. But my message is clear, and it's to everyone, is that if you can work from home and achieve what you need to from home, then employers should be considering that.
Hi, Dr. Roussin, it's Michelle again from the Brandon Sun. I think this is my third go at this kind of question, but here's a different way of wording it. So are you guys keeping numbers on how many people have tested positive for COVID but have not needed medical treatment? Or what percentage of positive people have had to be admitted to hospital? Do you have those stats?
Yes, yeah. I mean, we know how many total hospital admissions we have, and we know the duration of stay on average and things. So we keep all those severe outcome issues, right? So we've had 1,092 total hospitalizations and 204 total ICU admissions. So we do keep track of that information.
Okay, so do you also have the number of people who have tested positive but have needed no medical treatment?
Well, it depends on what you mean by no medical treatment. Certainly that's just the total minus that is the ones that haven't needed admission. Having no medical treatment on whether they've, attended a physician for outpatient care. No, we wouldn't have a way of tracking that.
Dr. Roussin, when are we going to get that data? I mean, we have to wait till Wednesday to find out how many people are in ICU because Lanette Siragusa isn't here today. Why isn't this data just given to us every day? Why do we have to ask for it every second day?
Well, we have 48 people in ICU with COVID currently.
Dr. Roussin, Bartley Keepus here. I'm sure you paid attention to that story out of Alberta last week where recordings of Dr. Hinshaw's conversations with the Premier of Alberta was there. What do you think Manitobans would get if somehow we heard what kind of discussions you were having with our political leaders here?
Yeah, I'd say they'd hear a lot of working in cooperation, a lot of deliberations, a lot of thinking about our approach. So I don't think they would really hear any negativity or anything. So certainly we bring forward opinions, we deliberate, and then we come to decisions. So, I would say that public health's advice is taken, and I can't, and I've said this before, I can't think of a scenario where I've provided advice that it wasn't taken up. Certainly there's some deliberation. We have to discuss certain impacts and how to implement different things, but public health advice has been taken here.
Dr. Roussin, this is Danielle from the Free Press again. I'm just wondering where the province is at with the PanBio antigen rapid test. Are we using that anywhere or preparing to use it anywhere?
We are right now preparing and looking for where that's going to be best utilized. We know that that's a test that it doesn't have as good a sensitivity as the lab PCR test, meaning there's a much more chance of false negatives. So we need to use it in scenarios where we don't have to rely on a negative. And so it's so we just have to figure out how to use these tests and where to put them appropriately.
Okay, so any like early indications about where that might be?
No, I think we're going to just get the plan fully made, and then we can make some announcements.
Dr. Roussin, Will from CJOB here. I'm wondering, do you keep track, or do you have any evidence of people redeveloping COVID symptoms after they've previously been declared recovered? Like, is that happening widely?
We don't see that here in Manitoba. There's certainly reports in the literature of reinfection. It's likely not to a great degree, but I'm not aware of any reinfection cases here in Manitoba. We certainly see people who have gone for retesting after they've recovered, and it's positive, but we don't consider them a case, because we know that positivity will remain for quite some time.
Thanks, everyone, and this concludes today's media briefing.